Andrew. Kids don't want to brush. They will do brush once a day, that too when parents force them, but they will definitely refuse. Or even if I talk about my own kids, they refuse to brush at night. So why do you think it is important to brush at night time, and how can you make brushing and flossing fun for kids, Dr. Andrew?
Yeah. So like I kind of touched on earlier, it's very important to brush at night before you go to bed because as you're sleeping, you're not drinking any things, you're not like kind of flushing out the bacteria with water. So it's an opportunity for plaque to start growing and causing cavities. So if you brush teeth before you go to bed, you kind of clear up a lot of the plaque on your teeth and makes it less likely that you'll get cavities, as you're kind of falling asleep. And to how to make it fun to brush. One thing that I also would recommend if your kids aren't brushed before bedtime is to kind of do it as a family. Kind of do it together. So everyone's all brushing for the full 2 minutes. You can play maybe like a 2 minute song. Then everybody can brush while the 2 minute song is being played, and then for a fact you're brushing for the full 2 minutes. But I think we kind of make brushing kind of a family affair with everyone doing it together. I think kids are more inclined to want to do it.
Do we have some songs that we can play like that we know we can write in the chat box for the for our families who is asking, or do we have some particular songs?
Yeah, I think there is one song which is like Brush My Teeth by Rafi. I've heard that's very a famous song for kids. And I think there are some apps also available if the parents can download, like some Brush DJ or Disney Magic Timer. These are some apps that they can play while their kids are brushing. Yeah.
Okay, I'm having a lot of questions here in the chat box. And one question, the family wants to know, why is fluoride important and how can my child get enough fluoride? Dr. Andrew,
The fluoride is
why
very
is
important. Yeah, so fluoride is very important because fluoride strengthens the enamel on the teeth. And the enamel is the outer coating of the tooth that kind of protects the inside of the tooth from cavities. And so, fluoride, if we don't have any fluoride, then kids are more prone to having cavities. And we can get fluoride in a variety of ways. The two main ways we get fluoride is through water fluoridation. Some everywhere in the world is different with water fluoridation, but in the United States, especially in Boston, most communities are water fluoridated to around 0.7 parts per million. So, I mean, that's probably the main source of fluoridation for kids. But again, also toothpaste have fluoride as well. Not the young for little kids under 2 years old, but mostly adult toothpaste do have fluoride in it. To I think more than 500 parts per million. I think 1,000 parts per million to 1,200 on average. Those are two main ways you get fluoride. And like I said, it was very important to keeping the teeth protected and to strengthen the enamel.
Thank you. And Dr. Nidhi already mentioned in different age groups, we should use different toothpaste. Awesome. Thank you so much. Another question parents usually ask, when we need to worry that the child might have dental problem before they hit to the dental cavities, when they should worry that they may have dental problems or dental issues.
I mean, I think the big thing is, if your child is drinking a lot of sugary beverages, eating a lot of candy, before they go to the dentist, I mean, that's something that I would kind of be concerned about, before going to the dentist. Another thing also I would kind of be on top of is thumb sucking. Thumb sucking kind of protrudes all the teeth forward. It can create crowding in the future. It can be destructive to how their teeth are developing, as they go through, the primary teeth, and then becoming the permanent teeth. Um, and I'll also be on top of mouth breathing. If a child is breathing through their mouth a lot, when they're young, some people believe that mouth breathing can lead to grinding and a habit of grinding their teeth, which is also very destructive long term, especially if it's happening to children. So, if your children are doing this stuff, I'd kind of definitely follow up with the dentist, and take the child in and make sure that everything is kind of being started on the right foot.
Okay, thank you so much. That's really helpful.
Dr. Shweta, I want to add a point here. I have noticed that there is a myth in parents, like a myth about these milk teeth or deciduous teeth. that they are always that they are going to shed off and new teeth will be coming. So sometimes
Yeah.
parents think that, oh, then why we need to go to dentist for those teeth they are all already shedding. But
Yeah.
I would like to say that milk teeth, they are very important. Please don't ignore them. Please, if there is any cavity, please go to dentist, because milk teeth, they guide the pathway for the permanent teeth. And they also guide the jaw movement and the cheek muscles movement. So I will say that it's very important to treat the milk teeth always. So like the front teeth, they start shedding from 6 to 8 years, and the molars which are there, they start shedding from 6 years to like 12, 11 years. So there is a time like that milk teeth, they are still in your mouth functioning. So if they get decayed, the kid won't be able to chew properly, and it will affect the upcoming permanent teeth as well, because if there is infection in the milk teeth, it may pass to the permanent teeth as well. So I will say it's very important to address the issues with milk teeth as well. Thank you.
Sure. Thank you so
That's a
much.
very
That's
good
really
point,
helpful.
Nidhi. I agree completely.
Yeah,
I
thank you,
hear that
Andrew.
question a lot from my patients too, is, why should we, what's the point of restoring a primary tooth? It's just going to
Yeah.
exfoliate in the next year.
Yeah.
And, the big thing is it creates to maintain the space between the teeth so the permanent teeth can come in and there won't be any crowding issues. And, when
Mm-hmm.
there's crowding, it's hard to brush, it's hard to floss, it's a lot of nooks and crannies for plaque to just kind of sit there. It's a lot easier to clean teeth with no appropriate spacing between them that are aligned correctly than teeth that are crowded.
Yes, that's correct. Yes, Andrew. I totally
Yeah.
agree.
And also,
Thank you
Dr.
so
𝒊𝒐, I
much.
had a question for you. I saw on your social media that you're talking about a game, like a backspell game. I was wondering, what's that about, and if we can maybe play a couple of rounds.
Sure. Yeah. We had a big competition in India where our team in India has organized this, and we have invited, or like a lot of people registered, like a lot of kids, more than over 50 to 60 kids were there. And in that, we did the back